reversible. All right, let's get into it. So when it comes to plastic surgery, there are doctors who are willing to do any procedures. What's considered risky? Dr. Anthony Yoon, America's holistic beauty doc, has a warning for us in being careful. And I do want to mention, whenever we talk about plastic surgery, we do talk about finding a board-certified plastic surgeon.
Yeah, so there really, unfortunately, the law allows any doctor to perform any cosmetic procedure that they want to, as long as they do it in their office. So you want to find definitely a board-certified plastic surgeon, somebody who's certified by the American Board of Plastic Surgery, because that way you know it's an actual plastic surgeon.
So in other words, you could be a doctor of anything, and you know.
And same way, if I wanted to, I could do a cardiac catheterization on a patient in my office tomorrow if I wanted.
My goodness.
I could do a hysterectomy if I want, even though I'm not trained to do that.
Really?
It's actually legal.
The last thing you want to hear is never done one of these before.
Right.
But
Let's try
I'll
it.
try it.
Just relax your muscles.
Okay, first I want to talk about breast implants, then we're going to talk about the booty. The breast implants, there has been news recently about certain implants being linked to breast cancer. Can you tell us what we've discovered?
Yeah, so technically there is a type of cancer. It's not breast cancer, but it's a cancer around the scar tissue of certain implants that can develop. It's called ALCL. It is a very slow-growing cancer. There have been about 450 confirmed cases in the United States, and it seems to be related to a textured breast implant. So breast implant surfaces come either smooth or textured. The textured are the ones that you may have heard called the gummy bear implant. That's this one here. And because of the textured shell, the belief right now is that you can get bacteria that grows in that shell, and after years of that bacteria interacting with the inner tissues of your breast, it can create a very rare type of cancer.
Okay.
So the solution really is don't use those textured implants. I don't use them myself. If you're going to have breast implants, now the FDA is not recommending that if you have them that you need to take them out or anything, but to be aware of that.
Okay,
and go to the FDA website if you want more information, definitely.
All right, let's talk about the Brazilian butt lift, which is what exactly?
So the Brazilian butt lift, super popular on social media, injecting fat into the butt to make it bigger. And you see that with so many celebrities nowadays, so many doctors who are Snapchatting it, Instagramming it. The problem is it has the highest mortality rate in all of cosmetic surgery. There's a study that showed among board-certified plastic surgeons, 1 in 3,000 mortality rate. And we're talking the people who have this done are young women, quite often young women of color. And to put them under the most dangerous operation to me makes no sense at all.
So you won't do it?
I don't.
So what can we do? Because we want bigger booties, Doc. I'm just going to be honest. I'm from Atlanta. It's a thing.
I can say exercise. I can say all that stuff.
Really?
There is a treatment now called Emsculpt, which is a device that uses electromagnetic energy to actually stimulate your muscles to grow in that area. That's brand new. It's just been out a few months. That is a potential non-surgical option. But people say it feels like you've done literally, if you do it on your abdomen, like 1,000 crunches.
Oh.
And it reduces fat and expands the muscle.
We gotta just start doing some squats right now.
It's basically just like doing tons of squats.
We want quick results like this one, you know?
Yeah, the problem is that what are you gonna trade it then for putting your life in danger? And that's the concern.
What about putting an implant in the bottom? Do you do that?
No, I don't recommend that either, because the problem is that is the dirtiest part of our body, and implants, if you get any bacteria on it, it gets infected and it has to come out, and there's just been too many complications with that. So I don't have a great option other than squats and possibly the Emsculpt.
Okay. When it comes to injectables, you have strong opinions on what's right and what's wrong.
So yeah, after Botox, injectable fillers are the #2 most common cosmetic procedure. Works great for so many people, but there are major complications you can get from that. You can, if it's accidentally injected into a blood vessel, you can get scarring, you can even get loss of tissue, and you can even go blind from it. And so the ones that I recommend are fillers like Restylane and Juvederm. These are hyaluronic-based fillers, so they're completely reversible if you have a problem.
Okay, so make sure if you're going down this path, you know what you're getting injected into your body.
If you do it once, do you have to keep on doing it?
Depends. Yeah, they do last anywhere from 1 year to 2 years. You don't want something permanent. Permanent fillers create permanent problems down the line. Use a hyaluronic acid-based filler, no question.
All right, boy, good. What do we have in here?
So it's a free ebook. If you're thinking about any type of a cosmetic procedure, go to my website, 10 Things Every Plastic Surgery Patient Must Know. We'll send it to you for free, and it gives you these 10 super important things if you're going to consider going to a plastic surgeon or a dermatologist for a cosmetic procedure, whether it's operation or injectable, even laser treatments.
Good stuff. Do your homework.
You have to do that because it's a wild west out there. That's what plastic surgery is right now.
Thank you, Dr. Yoon.
Thank you so much.
Dr. Anthony Yoon.